Well, good morning. I'm Karen Simpson. I'm the co-executive director for the Southeastern National Tuberculosis Center here at the University of Florida. Hello to all our friends. Welcome. We're here in Gainesville at the University of Florida and also have a large audience via web. So welcome to all our friends out there across the U.S. For all those who have attended Keeping with the Pace in the past, we're very glad to see you all again. And to those who are new this year, welcome. We're glad you're here. Get my mouse so I can forward it. So for those old-timers who have been with us for many years, you might recognize this old flashback of our agenda from 1994. This Keeping with the Pace conference has been an annual event that began in the early 90s in response to the need for HIV-related training for healthcare providers. This event's grown over the years to be a large conference. Many of you might remember those larger conferences. And now it's an abbreviated version that reaches even more people by web. Due to generous past and current vendor support, we've been able to offer this conference to you now free of charge. We will continue to offer this event free to you as long as we can. I'd like to say a brief thanks to our planning committee. Without all these folks, we wouldn't be able to have you all here today. They represent several different organizations, including the Florida Department of Health, the AIDS Education and Training Center, the Swanee River Area Health Education Center, and the Southeastern National TB Center. Just a few important details that I'd like to go over with you. For those who are here in the room with us, on your table you received some handouts which included an agenda, participant information form, and an evaluation. Please complete those and leave them with us as you leave today. And for those of you who are joining us by web, you'll receive an email that has a link to an online evaluation with this PIF form, and you'll have instructions on how to complete that. Speaking of evaluation, immediately after this event, everyone will receive a link in an email to an online evaluation. You must complete this online evaluation if you want to get a certificate or the CECME. And you have 2 weeks to complete the evaluation. Don't come to us on November 14th and say, I didn't do it. So sorry. November 13th, that's your date. This is required for licensure credit, and the good news is as soon as you complete the online evaluation, you print your certificate. So nice and easy. An incentive to do it, huh? You may only claim those hours of which you participated. I think you all know the drill. Our presentations will be available on the same website where you registered. So it's the Stellar Ed Solutions from the AHEC site. So you can get your presentations later if you want to access them. And now a big thanks to our sponsors this year. Again, without them, we wouldn't be able to offer this conference to you free of charge. Janssen sponsored the lunch, and the other exhibitors are here, and they want to have a chance to talk with you. So during the breaks, please visit with them, and please thank them for joining us. You may notice that over the years, we have fewer and fewer exhibitors, so we really do value those that do come and join us. So you have an agenda. You'll see the agenda. There's a brief 30-minute coffee break after the first sessions. So please take an opportunity to go next door and grab coffee and talk with the exhibitors. And then there's going to be another break at noon where we'll have lunch here on site. For those who are joining us by web, mark that time and come back and join us at those time periods. Let's see right here. We'll try to keep it around 10:30 to 11 and then noon to 12:45. This event is being live streamed. You'll see the cameras and the microphones around the room. So please be aware that any noise in the audience can be picked up on the mics. You are being recorded. And cell phones, everybody take their cell phone out right now. Put it on silence, vibrate, so it doesn't ring during the session. Try to keep the noise level to a minimum, please. If you have any questions, don't hesitate to contact any of the conference staff, including the AHEC staff that are sitting out front, and they'll be glad to help you. And I have the pleasure of introducing a longtime colleague who's worked in HIV a little bit longer than I have even, way back when. That sounds bad because it makes it sound like you're older than I am, so I didn't mean to imply that. Longtime friends, longtime co-workers. Our first speaker is Koehler-Sides. She spent her whole professional career working in public health and now is the District 313 AIDS Coordinator from the Alachua County Health Department here in Florida. Today she'll be presenting Epiview and more. Gay? Thank you.
So good morning and welcome again, and thank you, Karen. Karen and I actually went to the University of Florida together, so that's how long when she says we've known each other for a long time. She's being quite honest there. So I'm going to give you a quick overview of Epiview. We're going to look at this epidemic from a global, national, state, regional, and we're even going to get down to some zip code level here. So we'll start by looking at our global summary, and you can see that we have almost 37 million people living with HIV in the world. And here you have the estimation to be living with HIV, and you can see that sub-Sahara Africa has our greatest proportion of cases. Our newly infected, you have the global there as well, and again, it's always sub-Sahara Africa has the greatest proportion of this epidemic. The number of deaths from AIDS, you see in the different regions in the world there that we have. This is something, as we go through this slide presentation, you're going to see we have dramatically seen deaths from HIV, AIDS decline in our country. And this is really shocking. 5,600 new HIV infections a day, every single day. You know, we have so much work to do. We've got lots of resources and lots of tools, but we've got to get them out to the world. So that's a huge concern. Then we look here in our nation, in our country, and you can see that we have many more males than females with this, and we have about 50,000 new infections a year. Most of our AIDS cases are in Black, African American. We have disproportion here. And here you see the rise. This continues to increase year after year after year. And we continue to see more males infected than females. Then we come home to the state of Florida. And this information, you know, one thing that we do really, really well, I guess we do lots of things really, really well in HIV world, but data, we're really good at this. We're good at this in our country, and we're very good at this in our state. So the stuff that I have chosen for you to look at today, if there's other stuff you want, it's out there. Don't think just because I'm not showing it, you know, it's not there. It is absolutely there. So the Florida Department of Health website, some of the slides I'm going to show you will be up next week because some of that is new information. But it is definitely, the data is out there. We can slice this and dice this any way you want to look at it. So if you don't see it here, you know, just get on the web and you'll be able to find it. So this is my good news, bad news slide. The good news typically is where you see a decrease or down. The bad news is where we see increases and up. And when we look at the bottom of the slide, HIV-related deaths down 6% from 2013. You know, that's definitely good news. When you see the 18% decrease in our incidence estimate, that's all good news. When we move up the slide, newly diagnosed AIDS cases down 21% from 2013. I think we're really at a point where, you know, we'll see people who will never be diagnosed with AIDS. Our treatments and medications, they'll never get there. That is wonderful news. Our drugs, our treatments, our therapies, working very, very well. So while they may be infected with HIV, they may never, ever in their life be diagnosed with a case of AIDS. All good news. The next one, as you move up that slide, newly diagnosed HIV infections in 2014. This is the bad news on this slide. We are now first in the nation for newly diagnosed HIV infections. We have beat out New York in this ranking, up 17% from 2013. So we in this state have great concerns about this. We are working very hard. There's lots of reasons for this, but primarily we know the man who has sex with a man population is driving this epidemic, and we're working very hard in this state. So we're looking to other states to see what they're doing. That got them out of this rank, i.e. New York, and put us up there. So we're working very hard to try to get us out of that #1 spot, not a place we want to be here. Then the other two, when you look at those boxes, you see the disparity between the population and the people diagnosed and living with HIV. So we have disparities there that we need to address as well. So lots and lots of work to do. While the work we're doing is, we're doing a great job, but we have lots more to do, and we will continue to do that. This is a good news slide. The number of perinatally acquired HIV-infected cases continues to decrease. And you see in 2014 we had 6 cases. We ideally, we would like this to be 0. And truly we have all the tools to get it to 0, but when women don't get prenatal care is when we see this happen. So if we could get them all to have prenatal care, we could get this to be 0. But that, unfortunately, is not the case. So we do still each year seem to see a few cases that are acquired. But it is definitely a good news slide. And here we look at HIV infection case rates by county of residence reported in 2014. And so you can see the numbers on the slides are the cases for that year, and then the rate per 100,000. And we do have a couple of dark areas in our region that we serve. On this slide, we see in 2014, 80% of the adult HIV infection cases were male, compared to 71% in 2005. Over the past 10 years, the proportion of HIV infection cases among men has increased, while the proportion among women has decreased. Here we look by age group, and we can see this compares our HIV infection to AIDS cases. And in our HIV infection, we see that 20 to 29-year-old group is the highest in our HIV infection, and then we see the older age groups are in the AIDS cases, the higher ranking. Men who have sex with men remains the primary mode of exposure among male HIV cases in Florida, followed by heterosexual. The heterosexual risk continues to be the dominant mode of exposure among the females. These are the tests that we have. Florida typically has the highest testing numbers in the state, in the nation, or one of the highest. We have a very, very high number of tests. The more people who know their own HIV status, the better off we all are. So we continue with these massive testing campaigns, and that's not slowing down anytime soon. We have an excellent testing program as well, advanced testing technology. These are some of the factors that affect the HIV/AIDS disparities, and they have starred the ones that they feel that we can impact in our HIV/AIDS initiatives. I argue that we need to be working on those other two as well, and I think we can do that. We just have to figure out how we can do that. I think poverty and unemployment, we know people who are employed, you get so much more from your job than a paycheck. And the amount of HIV in the community, we are working very hard. We're going to have a panel later on to discuss that, how we can decrease the transmission and try to decrease the amount of HIV in our community. So I argue that we need to be working in all of those areas, and we can, in fact, impact those other ones as well. Impact of STDs on HIV infection. This is very important, and such that we have a STD speaker who's going to be here later today. from Wake Forest Baptist Medical Center. And we also work very closely with our STD program locally and the state because the co-infection and you see the impact on HIV infection is huge with those other STDs. So we are really working very closely together, and we will continue with that. And then here you have the other STDs, and you see that chlamydia is the most there, followed by gonorrhea. So those are for the state of Florida. We also locally have a high number of STDs that we work very hard to try to minimize those. And these are the slides that will be available on our web. The person who created these said they should be up there next week. So there could also be some tweaks, so if you get to the web and there was something slightly different, it's just because these are still somewhat preliminary. So first of all, we'll focus on Partnership 3, which is where we are today, and the other 10 counties. So you see our population that we have in Partnership 3, 576,000. And then the persons living with HIV in our area, a little over 2,000 people is what we have here. And then again, we see increases in males, decreases in females when we look at our HIV infection. Among black males, the HIV infection case rate is nearly 5 times higher than the rate among white males. Among black females, the HIV case rate 19-fold greater than the rate among white females. Among Hispanic males, the HIV case rate is 2 times higher than the rate among white males. So you see the disparities. Male-to-male sexual contact remains the primary mode of exposure among male HIV cases in Partnership 3. You see that huge increase there. Again, this shows all the work that we have to do. We'll look at living cases of HIV, and here you just have some nice pictures to show you. Makes it easy to look at and understand what's going on. Most of our cases are in Alachua County. You see the majority male versus female. The transmission between MSM and heterosexual is, almost equal in our area. And then you see the disparity in the race. And these slides that I have are by zip code. And I really just put these in here. I'm not going to spend time with this. But for those of you who are trying to implement HIV prevention programs, testing campaigns, I just want you to know that this is all available. And so you see we have it by exposure. So we have all of that by zip code. So when you want to target your interventions, this can help us with that. And then here we have by zip code with race, ethnicity. 1 dot equals 3 cases, more. Then we see our prevalence here. That just keeps going up, up, up. I don't know. I hope we see the day where we can start to see a decline in that, but we haven't seen it, and it's on this continual, very steady rise. So this is our Continuum of Care slide. Hopefully, this is not the first time you've seen this slide, but this is new information for our area, and the state has just put these slides out. It's very important. I call this slide as our Bible. This drives everything that we do in the HIV and AIDS program from the top all the way down. And we are all working in some way to improve that very last bar there. I will quickly review for those of you who may not have seen this slide before, but the first bar that you have there is the HIV diagnosed, persons diagnosed and living with HIV in Florida through the end of 2014. Then the second bar, ever in care, the one that says 95%, so those are persons living with HIV with at least 1 documented viral load or CD4 lab, medical visit, or prescription since HIV diagnosis. So all they're doing is taking 1937 over 2043. They just divide. That's all they're doing to get those percentages. Then the third bar that you see, this has two percentages in there. The first one is in care. Persons living with HIV with at least one documented viral load or CD4 lab, medical visit, or prescription in 2014. Then within that same bar in 3, so that for us in Area 3 is 79%. Then we have retained in care. Persons living with HIV with 2 or more documented viral load or CD4 labs, medical visits, or prescriptions at least 3 months apart in 2014. So for us, that's 72%. On antiretroviral therapy is the fourth bar. Estimated persons living with HIV on antiretroviral therapy in 2014. And this is an estimated amount that they get from our medical monitoring project data. So that's an estimate. And then finally, we get to that suppressed viral load. Persons living with HIV with a suppressed viral load less than 200 on their last viral load in 2014. So this is the bar that we want to be 100%. I'll tell you very, very proudly that 64% is the highest in the state. There is no other area in the state of Florida that has a higher suppressed viral load than Area 313. So give yourself a hand. Woo! There is another area that is tied with us, so we don't take that alone, but we're happy for that. And the state, and I will show you the state as well later on in this presentation, the state average is 58%. So we are above the state average. I think the lowest area in the state is at 51%. So that's sort of the range that we have. And this slide, I believe this is the third year that they have put this out. And we cannot compare last year or the year before. These are all individual. They are hoping this year this will be our baseline because they keep getting more data. You know, they keep getting better information to come up with these numbers and then the percents. So we can't compare from our last year's, but what we can do is compare in the state, and that's what we are doing. This may also be a reflection because we have such good data that we put in, but we'll see as the years go by. Is this going to be our final baseline? I don't think so. This doesn't include Medicaid data, so I'm hopeful that they're going to continue to be able to add to this to get it even better, but then we will hopefully get to a place where we can track and we can compare year after year after year. We also want this by county. We want it by clinic. Okay, this is 313, also 64%. The deaths, this is a good news slide that we have here. We're going down. That's exactly what we want. Partnership 13, we're going to see the same slides that we saw for Partnership 3, so we don't have to explain those. But Partnership 13 has a higher population and a higher number of people living with HIV in that partnership. So that's to the south of us. They also have more males than females. Here we also see the black males, the HIV case rate is nearly 3 times higher than the rate among white males. You can read the rest of that for yourself. And then here we have 31% of HIV infection cases occur among those age 50 or older. And then the females, 38% of the HIV infection cases occur in the 50 or older group. So we do have some differences between the areas. Male-to-male sexual contact is still the primary mode of exposure. Heterosexual risk is the dominant mode of exposure for females. And then our living, you still have the same picture here. You see Marion County has the highest number, followed by Lake. And then we have all of these zip code. And again, as I told you, these are just so you know the kind of data that you have available to you when you're planning your prevention, targeting, clinics, whatever you're looking to do. So all of that is available to you. Then this is the Area 13 Continuum of Care, very similar to the Area 3, maybe 1 percentage point off, but that last bar is the same, 64% suppressed viral load. That is an excellent number. And then here you have the combined 313. When we look at the deaths, we see deaths declining in Partnership 13 as well, so that's good news. Presumed living, Marion County has the highest number of cases, followed by Alachua, and then Lake. This is the state of Florida Continuum of Care. As I told you, 58% suppressed viral load. You can go through that and make your own comparisons, but we are doing better than all of those. So that's good. I've given you the top priority populations. Again, if you are wanting to target interventions so you know what's going on in the state, black heterosexual men and women is number 1. White men who have sex with men is number 2. Hispanic men who have sex with men is number 3. And then when we look in Area 3, we have black heterosexual men and women, black men who have sex with men, and then white men who have sex with men. Area 13, white men who have sex with men, black heterosexual men and women, black men who have sex with men. And then I've got the National AIDS Strategy, the goals, reducing new HIV infections, improving access to care and health outcomes, reducing HIV-related health disparities, achieving a more coordinated national response. Hopefully you have already seen that. You're very familiar. This section, I want to point out the southern United States. More than 1/3 of the population lives in the South, but the region accounts for more than half of all HIV diagnoses. Huge disparities there. And that is my daughter and her roommate dressing up the cats for Halloween. So I think I maybe have a minute for a question if you have any. If you do, you have to go up to that mic, and I think I have to bring you this mic if you want to ask a question. But if not, I will be here all day, so I'm happy to answer any questions. Okay. Well, Jennifer is here, and so we are so thrilled and always so fortunate to have this woman in our area on our team. Jennifer Janelle, infectious disease specialist, one of the smartest doctors and women that I know in my life. So you get to listen to her next. We love her presentations. Thank you, Jennifer.